Hello everyone, this is Lindsay Rotes and we're going to be speaking about how experts speak on intimate partner violence. It's April 24th, 2017, and this is for Psychology 496. So starting with a brief overview on intimate partner violence. Intimate partner violence is a very common issue among people in our world. Both women and men have been known victims to violence, and this violence includes physical violence, sexual violence, psychological violence, and emotional abuse. An important topic on this is the abusers themselves and what their motives are and what risk factors can increase these motives. Intimate partner violence is a very important issue because it is such a common problem, especially among women. 1 in 3 women and 1 in 4 men have been victims of some form of physical violence by an intimate partner within their lifetime. There are many factors that increase the risk to intimate partner violence, and substance abuse is one of them. If substance abuse is not to blame for domestic violence, then there's the issue of somebody that is wanting to attain power or control over their spouse or partner. So I developed my 2 questions around this topic. If the abuser is influenced by drugs or alcohol, is the substance to blame for the violence? Or is there an underlying mental illness causing the abuser to feel the need to have such tight control or power? So moving on to our experts, let's start with Ronald Baptist, who has an MD/PhD from the University of Colorado School of Medicine. His current career is working at Colorado Psychiatric Center with children, adolescents, and adults. Ronald Baptist has been a psychiatrist for 17 years, and he specializes in the prevention, diagnosis, and treatment of mental disorders, emotional disorders, psychotic disorders, mood disorders, anxiety disorders, and substance-related disorders. So next is Brooke Smith, who has a master's in social work from the University of Colorado. Her current career is family services, social work of the Colorado Springs region. Brooke has been a social worker for 10 years. She has experience with domestic violence, substance abuse, child neglect, and overall assistance with helping families solve and cope with problems. So starting out with Dr. Ronald Baptist on the topic of intimate partner violence. Dr. Ronald Baptist examines the issue of intimate partner violence by defining how certain personality characteristics or personality disorders can result in an individual having increased aggression that may lead to psychoactive substance abuse and intimate partner violence. Although some posit that psychoactive substances may only exacerbate intimate partner violence, risk factors for individuals already prone to aggression, such as someone with antisocial personality characteristics, present findings that indicate that some individuals may be more prone to intimate partner violence, in part because they use stimulants more frequently. So somebody that has antisocial personality characteristics, they're more prone to aggression because they are they're abusing the stimulants more frequently than somebody that may not have a personality disorder. So it should definitely be recognized that anger is a key component in the personality traits of perpetrators of intimate personal violence. This anger and other personality traits can be responsible for violent men to have a desire to control their partner. And so overall, men's violence against women is influenced by many different things: societal, psychological, biological, and familial risk factors. These include men's gender role, socialization, alcohol and/or substance abuse, isolation, economic disadvantage, witnessing or experiencing violence in family of origin, child maltreatment, stress, gender inequality, and psychopathology. And so below here is a attached website for people to examine on interpersonal or intimate partner violence and substance abuse. Moving on to social worker Brooke Smith. Brooke has dealt with many family cases in which substance abuse was a problem and violence was occurring within the home. It has always been known, people know that drugs and alcohol are commonly known for their effects to how they affect the brain chemistry and how it can make an individual act in a manner that is not particularly normal for that individual. So the correlations, there have been many correlations of drug and alcohol abuse with intimate partner violence, but it needs to be made clear by experts that substance abuse cannot be to blame for intimate partner violence. It is more of a risk factor to intimate partner violence occurring. Substance abuse has been found to co-occur in 40 to 60% of intimate partner violence incidents across various studies. Several lines of evidence suggest that substance abuse plays a facilitative role in intimate partner violence by precipitating or exacerbating violence. And Brooke has found commonly on her cases and experience that the illicit drug of cocaine has been commonly associated with violence. Cocaine acts as a psychomotor stimulant, the acute use of which has been associated with suspiciousness, increased irritability, and psychotic symptoms. Many people that use illicit drugs, it leaves them feeling careless and out of control, which in turn can actually make that person look elsewhere for control because they feel out of control from the substance. So they look for control through their spouse or their partner. Especially when the side effects to illicit substances includes paranoia, suspiciousness, increased irritability, and psychotic symptoms. And below, Brooke has attached a website to look up more information on intimate partner violence and substance abuse. So let's take a look at our comparisons and contrasts. Dr. Ronald Baptist, his beliefs was personality traits and how they can affect somebody in their anger or their use of substances. Substance abuse is a key factor again with Dr. Ronald Baptist, and then anger and control are the third for Ronald. And so social work Brooke Smith, her first key is substance abuse. It's been a common thing she's seen throughout her experiences. Cocaine is specifically one of those drugs that have been seen throughout her experiences. Anger/control is her third thing. That's a number of people experience anger and some kind of control is there. So that is where it has met in the middle, that anger and control is ultimately where intimate partner violence can stem from. So, yes, that is it. Thank you, everyone, and I hope you enjoyed my presentation.